with each other. But again, you still have time to have a life. I still see my girlfriend 4 or 5 nights a week, absolutely, all the time. She would not have it any other way, trust me. So you certainly have a life. It's all with balance. And again, as has been said, don't judge it by what's in the residency. Judge by what happens when you're an attending physician. What do I like the least? Early mornings in January. I wake up at 5:30. I get to the hospital, or 5 o'clock, I get to the hospital, it's dark. I leave at 7 o'clock at night, it's dark. It's always dark, a bit pale. It's very painful. But again, winter turns into summer, and you go on more busy services and more lax services, and so it isn't always terrible. You always have bad spots, just as has been said before. Again, it's sort of the nomadic trek of residency, which I don't think has been sort of addressed. Because you don't spend all 5 years in the same hospital with the same group. You move around, especially in McGill, we have 4 or 5 different sites. You go to other universities, they can sometimes have 8 hospitals. And so every month or every 2 months, you're at a different place, learning a new system, with new people you have to impress, and they have no idea who you are. And so that's one thing I actually don't really like about surgery, because you're working very close to them. So they don't know who you are. You sort of go from being first assist on this case, the next day you're in a new location, and you're watching. That's one thing I hate to do, is watching the OR. I spent so much time as a medical student watching the same procedures over and over again. It's painful to watch it. And the nice thing is that you actually get to do something when they trust you. So what do I like the most? Knowing that I made a difference. Learning a new technique is obviously great. Learning from my mistakes, and as bad as your mistakes will be, there are other people to cover you. And yeah, telling people, I'm a surgeon. It's great, and all the single guys out there who think they can never get a girl, become a surgeon. It really helps. That's being a bit superficial. I'm not trying to be mean here, but just trying to make a joke, make people laugh. What is it like to be a surgical attending? Much better. You control your life. You have people like me who are on call for you all the time, and they just call you, yeah, okay, 84-year-old guy. He's got a hip fracture, we need to operate. I've been with him for an hour. Great, I'll be there in 2 minutes, and we'll be done in half an hour, and I'm going to go home again. That's what it's like to be a surgical attendant. You get to control your life. And the nice thing is that, as you'll see in Quebec, you're in demand. So if you can say, I can only work 4 or 5 days a week, 4 or 5 days, you only take call for so many times, people will usually acquiesce and do what you want. You can really control what you want because you're in demand. And of course, you have time to do research, especially in academic institutions. If you want to go to Harvard or the Mayo Clinic, you have to do research now. They're really demanding people do fellowships and do research to be surgeons. And of course, there's call, which if you have residents in an academic institution, it's a lot better. And when you're a staff, like a staff orthopedist, you can actually take just 3 calls a month, or sometimes even less, depending how many people are in your group. So what about orthopedics? Again, musculoskeletal system. So if you're this unfortunate person who sprains their ankle, or this sort of exaggeration, really falls down hard with their ankle, then they come in, the radiology resident reads it, but by the time the radiology resident's read it, I've already read it, I know what's going on. There's a fracture right there. There's a fracture right there. We're going to take him to the OR, we're going to fix it, end of story. And so we go ahead, we make an incision, we put a plate on, we put a nail on, and everything's great, we're very happy. And that's the nice thing about surgery, you see your results. But also we have more chronic cases. So here's a normal hip, here's the head of the femur, it's the pelvis for everybody, it's a normal femoral head there. There's a nice clear joint space where your cartilage is supposed to be. And this is what osteoarthritis looks like. The joint space is narrowed, you have some little, you can see how the bone here is not as white here as it is over here. You have some subchondral cysts, and this is arthritis. And what you do, you take out the femoral head, you put in a total hip replacement. This is actually a hemiarthroplasty, where only this part is metal. The total hip is when we also put this, we replace the acetabulum, or the joint up here, with metal. And then Mr. Smith can go back and be functional again and play tennis. And also when Pedro injured his rotator cuff,